Welcome to Dental Office Emergencies, Model 10. This week, we will review videos on epistaxis and excessive bleeding. The readings of chapters 19 and 20 are required to complete the quiz bank questions for the week. The topic for your 7th discussion posting will be presented at the end of this lecture.
Epistaxis. What is epistaxis? Bleeding from inside the nose is also known as epistaxis. Why does it occur? There are many different reasons. Most important ones are among children due to trauma due to nasal picking. Another important cause in children is foreign body and nose, infections of nose, deviated nasal septum, raised blood pressure, kidney disease, and liver disease. What are the sites of epistaxis? 1. Most important site of epistaxis in nose is Little's area. In 90% of cases, epistaxis occurs from here. It is situated in antero-inferior part of nasal septum. 4 arteries: anterior ethmoidal, septal branch of superior labial, septal branch of sphenopalatine, and the greater palatine artery, anastomose here. 2. Posterior part of nasal cavity. After bleeding from here, blood flows directly into pharynx. Diffuse. It is bleeding from septum and lateral wall. This is often seen in general systemic disorders and blood dyscarsias. How will you manage a case of epistaxis? In any case of epistaxis, it is important to ask the patients: 1. Mode of onset. Was it spontaneous or was there fingernail trauma? 2. Duration and frequency of bleeding. 3. Amount of blood loss. 4. Side of nose from where bleeding is occurring, or is it occurring from both sides of nose? 5. Any known bleeding tendency in patient or family? 6. Any history of drug intake? Analgesics, anticoagulants, etc. How will you treat epistaxis? 1. First aid. Most of time, bleeding occurs from Little's area and can be controlled by pinching nose with thumb and index for 5 minutes. This compresses blood vessels of Little's area. 2. Cauterization. Useful in patients where bleeding point has been located. 3. Anterior nasal packing. 4. Posterior nasal packing. General measures. 1. Make the patient sit up. 2. Reassure the patient. 3. Keep check on pulse and BP.
At the completion of the surgery, the bleeding has stopped, but you will bite on the gauze while you are in the recovery room and will continue to do so for 1 hour. The gauze should be placed directly over the surgical sites, and you must continue to bite with very firm pressure for 1 hour. This is a critical point because it is the pressure that controls the bleeding. It is not enough to simply lay the gauze in the mouth, as the gauze will act as a sponge and may cause the bleeding to continue. After at least 1 hour, the gauze packs are removed from the mouth and should not be replaced. It is critical that you do not disturb the blood clot for the first 24 to 48 hours. You must not smoke, spit, use a drinking straw, or rinse the mouth. There is always a small amount of oozing that will occur for 1 to 3 days after the surgery. This is usually a tiny amount of blood mixed with your saliva, which will appear pink or blood tinged. Do not be concerned, this will not require the use of gauze packs. If heavy bleeding reoccurs, it will be necessary to place gauze packs over the surgical sites that are actively bleeding and bite very firmly for at least 30 minutes. Heavy bleeding is described as active bleeding coming from the surgical sites, filling the mouth to the point where you actually have trouble speaking. If bleeding continues after 30 minutes, dip a caffeinated tea bag in cold water, wrap in gauze, and place it directly over the surgical site for an additional hour. The tannic acid in black tea aids with the formation of blood clots and makes this method very effective for most patients. Also remember that activity encourages bleeding. It is important for you to rest and remain inactive, especially for the first 24 hours. If significant bleeding persists, please call the office.
Please address the following questions for the discussion posting this week. A patient calls the office 2 hours following a root planning appointment and complains of excessive bleeding from the site. The patient does not have any history of excessive bleeding. What questions and recommendations will be offered for this patient to address the problem? Please post to the discussion your initial posting by Wednesday midnight and complete a response to one of your peers by Sunday midnight. This concludes the audio lecture for the week.